Well, the South African Medical Association, we feel strongly that by rather focusing on the strengthening of our health facilities and vaccinating our healthcare workers would be a much more sensible approach now. By going into any hard or further lockdown, it's not going to achieve any meaningful outcome. We need to understand that we needed to have done this before. It's now too late to think that any further stricter lockdown is going to change this trajectory of the virus. It's also important to understand that this 501V2 variant that is currently out there is a highly transmittable and infectious virus, and it's already out. You can't curb it anymore. You now need to strengthen your facilities and your behavior. So therefore, SAMA feels that going into stricter lockdowns it's not really going to add any positive improvement on stopping the virus. So if you look at at what SAMA said right in the roundabout just before middle of December, we identified the need for already a further lockdown, and we asked for a level 2 lockdown, and yes, we got level 3 lockdown. So in the current level 3 lockdown, some of the things that we as SAMA can ask for is to say that looking at the social gatherings is to rather look at curbing those numbers to between 10 and 20 people instead of having a stricter a lockdown. But then it's also extremely important to understand that stricter adherence to the current lockdown regulations by both our patients or the public and the law enforcement officers is extremely needed. We need that. Again, also in level 3 lockdown, we noticed that the banning of the alcohol helped alleviate the pressure on especially the casualties as well as the hospitals. Also, SAMA acknowledged that this is only temporary. There's a much bigger social problem underlying that needs to be addressed during this after the COVID-19. SAMA also has been asked about the ban of the tobacco. And again, SAMA's we totally acknowledge the harmful effects of tobacco on people's health. And but from SAMA's side, we need to see, we needed a comprehensive and scientific studies that will prove to us that by smoking, you can actually spread the COVID-19 or the virus and impacting on the rise of the COVID-19 pandemic. So if you can have those studies, then we can, look at our stance regarding the banning of cigarettes.
I find that quite interesting, Dr. Coetzee, as the Medical Association. Perhaps smoking is not necessarily going to spread COVID-19, but the effects of smoking on the lungs, those are statistics that have been quite well documented. And our understanding of the COVID-19 virus is that it does affect the lungs. And so what you need to have is a very strong lung capacity in order to even be able to fight it. Just your thoughts and comments on that.
Okay, so it's important to understand that once if you stop smoking, it takes about 9 years for the lungs to recover. So by banning it now at this stage, you're not going to get any positive outcomes on the lung capacity. Lung capacity doesn't change overnight or in few days or in months. It takes years to change your lung capacity. So that's the first thing. The second thing regarding smoking, if you would like to stop smoking and ban smoking, you would need to have a proper system in place where you take a patient through a process of stop smoking. You cannot, say, stop it. It's addictive. You need a process. You need to program an addictive program for people to get them to stop smoking. It's not, you cannot just ban it and think now it's going to work. I'm sorry that, we need that studies telling us to stop and ban smoking. that within 2 or 3 months, you're going to have a change in lung function, you're going to have a change in behavior of the patient, you're going to add positive benefits to that patient.
So you're basically saying that stopping smoking now is not really going to have a material effect on how you respond to the virus. One of the things that you said, Dr. Coetzee, is that focus should not be about going back to a stricter lockdown level, forget level 5. But what you're saying is that basically our hospitals need to be capacitated and that there needs to be, as you say, a strengthening of the health facilities. Talk us through how the health facilities ought to be strengthened, and that also in juxtaposition to what the health department has already done in that sphere.
Okay, so some of the view that, we need to look at better quality of the PPEs. And then there should not be a 85% availability of PPEs to some of the hospitals, whether it's private or public sector. It should be 100%. You cannot say, I've got enough stock, I've got 85%. So it means that at least 15% of your stock is not there, and that might be extremely needed for that healthcare worker or that doctor. So that's the first thing. The levels must be 100%, and we cannot accept 85%. It must be 100. Then again, we keep on saying this, and we can't see it happening. And we would also like to know what is the government doing on this. But appropriate training of your nurses and sisters working in these high care and ICU facilities. You cannot just simply take a sister who's qualified to work in a theater and put her into a high care and ICU ward where she needs to look after COVID-19 patients. You're putting her up for failure, you're putting the patient up for failure. So we need properly trained staff. Then, again, on the staff, there's a moratorium placed on nearly all provinces on existing posts, not to be filled. And how on earth can you, in the midst of a pandemic, still have moratoriums placed on posts and then say, well, there's not enough money, blaming money for the reason why you have that moratorium? It's not fair. It's not fair against the system. It's not fair against the patients. It's not fair against us, taxpayers. Then on essential equipment, what we are saying there, we have noticed from our members the oxygen, especially the oxygen ports, and then the oxygen, the proper and constant need of pressure of high flow oxygen. So there needs to be an alert system put in place. If those oxygen levels starts to drop in these facilities, it needs to be addressed. We have seen now what happened at Linmed Hospital, and it's extremely important. And that's not going to be the only hospital. I can promise you, it's the same hospital, not the same hospital, across the country in a lot of other hospitals, by having a lack of the high flow pressures that is needed. If you look at our border posts, that also is a problem. So this is all things that I think that some think that we need to address before we start looking at further lockdowns and try to see whether we can curb the virus by doing that. So if you look at the border posts, and we're all aware of all these long queues that is now being created, for us, that's a real danger zone. Because if you look at the lack of sanitary geriewe, it's not there. Water, food, people coming together there, standing out. Although it's out they are out in natural ventilation, it's still a huge problem. That is going to create a lot of super spreaders for us, and it's going to cost us dearly moving forward.
I'd like to touch on Dr. Coetzee. I'd like to touch on the call for the lifting of the moratorium on medical staff. What are you as SAMA actively doing to ensure that this moratorium is indeed lifted? As you say, as many competent and qualified medical staff are needed in order to be able to deal with this virus.
So from SAMA's side, we have written to two of the MECs. We have written to the MEC of KwaZulu-Natal, We have written to the MEC of Eastern Cape. We will now send our letters to the other MECs of the various other provinces to get meetings. So far, we haven't got any reply back from the MEC of KwaZulu-Natal. The MEC of Eastern Cape told us the second week in December that she's a bit busy, she can't meet with us now. The other thing is we did meet with the health department of the Northern Cape, and I can say here, and I want to thank again the people involved in the Northern Cape because we resolved the frozen post of 33 doctor posts. There was already doctors allocated to those posts, but it was refused because of the moratorium, and they lifted that moratorium. So you can think for yourself, Kimberley Hospital, one of the busiest hospitals, it's actually the only hospital in the Northern Cape, looking at public sector patients, running on a loss of 33 doctors. It's quite a lot. So, but as far as we are concerned, we're not going to stop. We know that there's a process from Action South Africa as well, asking SAMA to be part so that we can starting put more pressure on some of these provinces to alleviate and to open up these posts. You cannot have a pandemic and then close posts. It's not acceptable.
And what is the status quo around the provision of adequate equipment in the hospitals? You mentioned that it's all good and well to have a number of beds, but if those beds, first of all, are not manned, and if those beds don't have the proper equipment needed to treat the patients, then they really are worth nothing. What is the current status quo regarding adequate machinery?
So that is very, very difficult to get all those stats from the provinces themselves. So we are listening to our members on the ground, and certain hospitals, it's fine. They cope and they manage. But there are, unfortunately, and it's public as well as private hospitals, that doesn't have enough ICU beds. So I want to make something very clear. There was some of the MECs during December told us that, SAMA is complaining and we are not truthful because there is a 66% bed capacity, especially in the public sector. Now, I want to say today, if you've got 66 bed capacity during December, it is because most of your chronic wards and your surgery wards are closed. It doesn't mean that you have a capacity to increase your ICU beds and your high care beds. That beds come with a certain, as we have said, HR component around them. And I think it's important that politicians making statements like this, telling the people out there, but we only have so many ICU and high care beds. I know that they don't want to cause panic, but in the end of the day, we don't trust them anymore because what they are saying and what we know, it's two different things. And it makes it extremely difficult then to start to trust each other going forward if there's mixed messages going out.
And unfortunately, time is not on our side, Dr. Coetzee, but thank you so much for just that in-depth explanation